Good morning, everyone, and welcome to this live event. I'm Marie Manning. I work in the Training Services Division for the American Red Cross, and I'm so glad that you're joining us today. First up, a housekeeping detail. You can drop questions or comments in the chat box at any time. We're going to get to them. We'll if it seems that we can get to them as we're talking, I absolutely will. Otherwise, we'll hold some for the end, and there will be a question and answer period then. This live is very timely as we head into the winter season. It's cold and flu season, and we all want to stay safe and healthy, and that's what this live is all about. We've got a great guest today, Dr. Ed McManus, who is a specialist in infectious diseases. I was just chatting with him backstage, and he has a lot of really good information to impart. Now, let me take a look at my notes and read from his very impressive bio. Dr. McManus, inspired by his mother, a post-World War II nurse, pursued a career in medicine focusing on infectious diseases. He contributed to early HIV treatments, including AZT and Atripia. As a co-founder of ID Care, he has expanded services, advocated for post-acute care, and led wound care initiatives. He also established a nurse practitioner program and served on various hospital boards, including as chairman of St. Clair's Hospital. One thing that we know about him is he values the problem-solving nature of infectious disease medicine, which offers a lot of challenges, but also opportunities for consultation. He has his vision and leadership have been vital in guiding the growth and breadth of services provided by ID Care, improving community access to healthcare. Dr. McManus, we're so glad to have you with us today, and thank you for joining us.
Well, thank you for the opportunity to have this venue to discuss a timely topic.
It really is. So, as you know, this live event's about the winter cold and flu seasons. Can you explain why and I'm grouping them all together, but I have colds, flu, COVID-19, RSV. Why are they more prevalent during the winter season? And did I get them all?
Well, I think right now the issue is as the weather turns cold, we all move inside and we come more in contact with each other. We have more face-to-face interactions. We're in rooms rather than being outdoors. And all these elements increase the risk of getting respiratory viruses, which are transmitted primarily through breathing, coughing, and being close to other people. So that's really why it really is the turn in temperatures that really drives all these infections. We think of them, a group of 3+1 right now. We talk about influenza. We want to talk about COVID-19. We want to talk about RSV. And a newer player that's becoming more prevalent is Mycoplasma pneumoniae, which in lay terms is walking pneumonia, which is having a resurgence now in this current year.
Why? I'm curious about that last one that you added to the list, because I have a colleague who has walking pneumonia, and I believe my husband had walking pneumonia a few weeks ago. Why is that seem to be ticking up this winter season?
Well, this would be purely hypothesis, but I think a strong consideration would be we've just gone through a period during COVID where we were masking, we were having less contact, children weren't going to school. And so what ordinarily happens is we get low-grade exposure to all these viruses and develop some natural immunity. If you get a block of time where you don't get exposure or you don't get a chance to see these infections for the first time, you're going to be highly susceptible. And I think a big part of this is children back to school who are very naive or never really previously exposed to mycoplasma now being exposed, and that getting into the community at large as we've moved inside and the respiratory illness season has begun. And what's important about that is it is an infection caused by an organism that's a mycoplasma. It's between a virus and a bacteria, and it is treatable with antibiotics. Macrolized antibiotics like azithromycin or clarithromycin can treat it. It can be treated with doxycycline. It can be treated with a group of medications called quinolones, Levaquin or Cipro. So it has a lot of treatment. It's not usually a life-threatening infection, but it often is an infection that can cause a lot of morbidity. And people often have a protracted cough that lasts for several weeks, sometimes as long as 2 months. And what's the hallmark of it, like many of these other viral infections, is that generally people have a non-productive cough. They're not bringing up a lot of phlegm. And so these illnesses all look very, very similar. And the importance for the public is that, there's tests that are available to help identify COVID-19. And if that's not the diagnosis, then to think about, well, could this be mycoplasma? And usually the thought there is, well, have you been in close proximity with school-age children? Are you in a communal setting? We have Thanksgiving coming up. People are coming together. And usually people are not screening themselves for respiratory illness before getting together with grandma or grandpa.
That is true. That is so true. And let's touch on that. Getting together with families, especially some of your older relatives, how can we protect? Thanksgiving's next week. How can we protect some of these vulnerable populations, such as the elderly or those with underlying health conditions, and yet still enjoy each other's company?
Well, I think that a lot of the things that we can do are things that your grandmother told you. If you're ill, you should stay at home or limit your activities or exposure to others. I think that it's important then to cover your face or mouth when you're coughing or sneezing. That can be either with a Kleenex or tissue, or with the nook of your elbow folded over. And the really most important thing probably is washing your hands. Before and after you eat. And other times after you've been in common areas where you're shaking people's hands or coming in contact with high contact surfaces. So when we're talking about high contact surfaces, we're talking about doorknobs, rails, staircases, tabletops, all those things are where other people have put their hands. And so that's getting exposure for you. We talked earlier about a lot of this exposure is respiratory, coughing, and sneezing, but a lot of those viruses, when you cough and sneeze, get onto your hands, and
Right.
then you touch a surface, and then the next person touches that surface, and now they have it on their hands.
Okay.
And so I don't think you can emphasize enough how important that is. And then part of that is also bringing your hands to your face, how much you're touching your face in terms of transmitting those viruses and infectious elements from a surface to your hand to your face.
Wow. So when we're talking about washing our hands, what if, we're in the grocery store, we don't have access to soap and water, for example? Will hand sanitizer also do the trick?
Yeah, sanitizer is very effective, but sometimes what I notice is people don't use enough. It's not like a magic liquid. It takes about 20 seconds for the liquid to work. So you have to think about your hands staying damp or moist for 20 seconds. Oftentimes people take the smallest little dab, cover their skin on their hands, and want it dried as quickly as possible. And that's probably not fully effective. It really takes time for the alcohol that's in the rub to kill or neutralize these viruses and mycoplasmas and bacteria.
Okay. All right. So here I am. I've done my due diligence. I've washed my hands. I've used hand sanitizer. I clearly didn't do enough because I'm starting to experience symptoms. What what should I do now? I mean, can I manage my symptoms at home, or should I seek medical attention?
Well, I think the most important thing is drinking fluids, staying hydrated. I'm never very worried about people who lose their appetite when they're ill, but I always am encouraging them to just make sure you're drinking fluids and staying well hydrated. And most of the time, if you're not better by the next day, you probably should seek some medical attention. If as long as you're not short of breath or feeling distress. Okay, and part of that also could be changed by having a COVID test at home. The government, through covidtesting.gov has 4 tests that they'll send to your home if you go to that website. And if you have tests from prior time, the FDA has approved all of those for a year beyond their expiration. So those tests that you have at home in the drawer may still be helpful to identify whether you may or may not have COVID. And the reason why we want to identify whether you may or may not have COVID is because we have treatment. There's 3 medications that we can use to treat COVID, and treatment reduces the risk of death, complications, and also reduces the risk of developing long COVID. So there's benefit for doing that screening test. If that screening test is negative and you still feel ill, it probably is valuable, particularly this year, to possibly see your physician about the mycoplasma and the risk of that, because that's also treatable. And you can reduce the severity of the illness by getting on some treatment.
So I always, well, I don't always. I sometimes hesitate to go to the doctor because I think, oh, it's just a bad cold. How do I know when it's just a cold or when it might be one of these respiratory illnesses?
Yeah, I think it's very challenging to make that separation. But I think that we might want to raise or lower the bar to see your doctor if you have chronic health conditions or you're over 65. And when we're trying to identify the laundry list of chronic illnesses that put people at risk, the way to think about that, I think, is if you're seeing your doctor 3 or 4 times a year for a health problem like diabetes, heart disease, hypertension, kidney issues, rather than trying to list a whole bunch of diseases, think about whether you're seeing a doctor on a regular basis for a medical condition as opposed to a routine physical or for just vaccinations.
Okay. Okay. Let's shift a little bit into changes, dietary or lifestyle changes that might boost my immune system during the winter. What can I do? What
Well,
first comes to mind?
scientifically, we don't have a lot of studies that look at that. It's really about a balanced diet. Eat the things you like, and you have to eat some of the things you don't like, so eat your vegetables. And it's really about having a balanced diet. If you have severe restrictions in your diet, those are the people who might think about taking a supplement. But I think that's probably the most important thing, is to stay physically active and a balanced diet.
And what kind of, you mentioned supplements. What kind of supplements or vitamins, if I want to take something extra might help?
So there's a large body of evidence that taking vitamin C is helpful. So vitamin C is in orange juice. It's in pomegranates. And you can take a supplement. It comes as 500 milligrams capsules over the counter. So those are important. There's some studies that have suggested that zinc is helpful. So taking a zinc supplement. And so looking at the labeling of a multivitamin might be helpful in terms of finding something that might contain vitamin C and zinc. And other than that, it's really about a balanced diet.
Okay. All right. And eat your vegetables, as you said.
Right.
All right. Let's go through. I have a list here of common myths that you hear around winter illnesses. So first one, does stress play a role in making you sick?
Well, stress is a very important factor in how active your immune system is. When you're under stress, your immune system is much more reactive. Just like when you're under stress, you're stronger, your blood clots faster, your immune system is more vigorous. And what can happen is that when you're under stress, you may have a more severe illness, because you have to recognize that when you get sick from a viral infection, there's the injury and trauma of the virus itself. And then a lot of how you feel when you are ill is your immune reaction fighting that infection. So, the role of stress is not so much that stress is going to cause an illness, but I think that stress is going to make an illness more severe because your immune system is going to be more vigorous in responding.
Okay. All right. Next one. Is it true you should feed a cold and starve a fever?
Yeah, that's a common myth, I think. What's really important is stay well hydrated, and to be up and active as you can be. But whether you feed a cold or starve a fever is could be even reversed. I'm not sure which comes first. So really, it's more about staying well hydrated and not complicating your illness with dehydration.
Okay. I'm going to take a pause here for a second and ask about hydration. What, when you say stay hydrated, what should I be drinking? I mean, I drink a lot of water, but I also have a lot of coffee. What is the best hydration one can have?
Well, to my view, it's all about moderation on a specific product. And so it's really about water, tea, juice. Uh, Pedialyte is the pediatric replenishment liquid, but even just Gatorade or products like that that have electrolytes in them. We don't want to be just drinking a gallon of water. We want to have some other nutrients and minerals in that. Even sparkling water is probably good as part of the balance, but we don't really want to be over exuberant in one narrow area, because that's going to lead to imbalances. Remember, the key thing we're trying to talk about is balance and moderation. Okay.
Okay. So it's okay to have a soda if I'm sick, but just not all sodas.
Right. It shouldn't be 2 liters. It should be
One
mixed in
can.
with other beverages.
Okay. All right. All right. Back to our myths here. Do swings in outdoor temperatures, so going from cold to hot, back to cold to warm, back to cold, how does that impact these colds? You mentioned something earlier where swings do tend to bring people inside, but is it the temperature variance itself that's the problem?
Well, I think the temperature variance is just another thing that stresses your body,
Mm,
and stress then leads to a more reactive immune system. I don't think per se that's a reason that you get the infection, but it might be a reason that it's more severe. And again, we mentioned that a big part of why we have winter illnesses is because we've all come inside to be together.
got it. Okay. Um, I think you answered this earlier, but can vitamin C, is a slight nuance here. Can vitamin C cure a cold? Is it a cure-all?
We don't really have a cure for colds. It can reduce the severity. It may help your immune system fight it off.
Mm,
But for a lot of these things, we get caught up with, and we also talk about, vaccines are miracles. The fact that they work and protect you from things doesn't mean they're necessarily going to completely eliminate your risk. A big part of the effectiveness of, for example, the flu vaccine and COVID vaccines is they reduce the severity. They don't necessarily prevent you from getting the infection, although we do have vaccines that do that. But most vaccines just reduce the severity of illness, which
okay.
is really a good thing.
Okay. And so that was going to be, you just answered my next question, which was, current thinking on vaccinations for flu and COVID-19 for this upcoming season. When should I be thinking of getting them?
Well, I think right now, most vaccines, at least when you initially get them, take about 2 weeks to have their full effectiveness. Fortunately, if you've already had exposure to the vaccines, the second and third and follow-up vaccines are quicker to get your immune system ready. You can think of vaccines as sending your immune system to basic camp, to training camp, to get it ready to protect you
Okay.
and fight infections. So you want to get your immune system trained here early at the beginning of the season.
Okay, great. And then here's another myth. Can a flu shot cause the flu?
Yeah, that's a great question to address, because I see many patients reluctant to take vaccines because they think that's happened. Really, you should be welcoming feeling a little bit off for a day or two after getting a vaccine, because that means your immune system is working, your immune system is ready. So, that's just the consequence of your immune system going to basic training to be ready. And it's not all these vaccines that we're talking about are vaccines that are killed. They're not live. So to try to get that understanding, yes, there's no question that you may feel a little bit ill following your vaccine, but that's just your immune system at work.
Got it. Okay, that's super interesting. And so what, what about the converse of that? What if I don't get sick after getting one of these vaccines? Does it mean it's not as effective?
No, I think it's still effective, but it's just I think when people are have different levels of sensitivity to how the immune system makes them feel. But those people who have that stronger reaction, they're just probably more sensitive to those subtle changes in their body.
Okay, I see. Um, what lessons have we learned from the COVID-19 pandemic that can be applied to handling other respiratory viruses?
Well, I think one thing we learned is that masks work. I think we've also learned that distances help. I don't think that we need to be precise on how far the distance is, but these viruses are are spread particulate in the air, and the closer you are to a person, the more likely those particles will land on you, land on your hands, face, and be breathed in by you. The interesting thing about wearing a mask is that that barrier protects you. And what's really interesting, I think, and some studies have shown, is that if you wear a mask, other people stay away from you. So there's a protective effect that's sort of indirect from the actual barrier itself.
Okay, got it. All right, I'm going to take some questions now from our audience here. Let me look in the comments box. Okay. I'm traveling for the holidays. What should I do to protect myself?
Well, I think that if you're traveling for the holidays, it's really about the crowdingness of being on a plane or a train. If you're somebody who at risk, I think you should strongly consider wearing a mask for your travel. The most effective mask is an N95, but a surgical mask is just a barrier. It's less complete, but it reduces your risk. Everything in life is about risk benefit balance, and we in most things, as a parent and as a grandparent, you want to see the reduction of risk. It's part of early childhood and young adulthood to seek risk. So that's a little bit different. But I think that wearing a mask can be very effective in those settings. If you're just traveling in your own car, we kind of move away from concerns about respiratory exposure and more to issues in terms of risk of a blood clot in your leg or something like that, in terms of taking long car rides and the risk of that, in terms of stopping frequently, get out walking, get a beverage or a snack, fill the car with gas, and try to think about that if your travels are more than 2 hours.
Right. And then wash your hands if you get out or use hand sanitizer for at least 20, make sure it's wet for 20 seconds, right?
That's correct. That's important,
Okay.
and part of that also might apply to people who are taking cruises for the holidays,
Mhm.
because you may or may not recall that some of the biggest outbreaks that occur are related to norovirus, which is
Yes.
very very contagious, and it's just about when you're on a boat, you're touching handrails, doorknobs, all sorts of parts of the structure, and hand washing can save your life and at least save your time and distress over having an illness.
Wow. Okay. Um, looks like we have another question here. Should I keep exercising outside during the winter?
Well, I think exercise should be a regular activity. We think that exercising at least once a week for 30 minutes, where you raise your heart rate, will extend your life. And I think that you have to prepare yourself, though, if you're going to exercise in cold weather, in terms of being properly clothed, and maybe wearing a muffler or some barrier to help warm the air that you're breathing. We have a wide range of the country where we're talking about how cold is cold. Maybe when it's 20 below, we need to exercise inside.
Okay. Um, all right. Another question here. I received a long list of vaccinations, shingles, pneumonia, tetanus. How do I decide what to get?
Okay, well, when, are we talking about someone who is 50 years old? Or are we talking about, children are on a normal schedule. They get something on the order of 60 different vaccines as part of their childhood before entering school. Then through our lives, we should be getting boosters along the way, particularly for polio and tetanus. And many of those are combined. For example, the tetanus is a Tdap, which also covers for pertussis. So those are important. And so those should be something that's addressed with your regular follow-up physicals with your primary care physicians. When someone turns 50, they really need to be thinking about being vaccinated for pneumonia and thinking about vaccinated for shingles. And then yearly, we should be thinking about these viruses, which I think are going to be more and more um, an issue in terms of something that may be combined. So the priorities, let's think about numbers. Okay, probably numerically the major issue is going to be now influenza. It's exceeding COVID-19. So influenza is probably the number one vaccine you should have. In the United States, 75 million people will get influenza this year. Probably 100,000 will be hospitalized, and we'll have probably on the order of 70,000 deaths related to influenza. COVID's probably second. It's really unknown how many people are going to have COVID this year because the illness is not nearly as severe as it was when it first became prevalent in 2020. But we are looking at numbers that are probably on the order of half as deadly as influenza. So maybe 30,000 deaths this year from COVID-19, and these are all just estimates. Okay. RSV is probably less of a threat for your life, but it can be a severe illness. And you also don't want to be the person who gives it to a young child who can be very sick from RSV. So RSV is more serious issue for people at the beginning and ends of life in their scale, and that's probably the third on the list. There's no vaccine for mycoplasma, and that you probably would need to see a physician to diagnose that. And again, that can be treated. And again, it's not usually a dangerous illness in terms of a threat to mortality, but it can lead to several weeks, maybe 3 months of cough as a consequence of just what happens is the illness sensitizes your airway and it's just more reactive to everything. So you may find if you can recover from the initial infection, and then you're left with a strong perfume triggers a cough. Stepping outside and breathing cold air triggers your cough, and just it's a severe nuisance. And other people want to know what's wrong with you when you're coughing all the time.
Right. That's true. Okay.
What's interesting is when you're looking at infectious cause of death, COVID-19 has just dropped down from the number one leader this past year. And another respiratory condition that's really not a major factor in the United States, but in the world, is tuberculosis. And that's really more a third world disease, or disease of low socioeconomic issues in terms of people who are homeless or communal living, in terms of what the risk is in the United States.
Right. Okay. Well, this has been really informative. I've been fascinated by this discussion. I believe that my husband may have had walking pneumonia, and so I'm going to ask a question of you, which is, it's been about a week and a half since the worst of it. Should I still be sending him to the doctor?
Well, he's no longer contagious, and I think that once you get over the first 3 to 5 days of illness, you're moving into more of the recovery phase and the effects of your immune reaction.
Great. Okay. Well, this has been very insightful for me, as well as I'm sure for our viewers. If you'd like to hear to our viewers, if you'd like to hear more content like this, please subscribe to a Red Cross feed. You all are joining us on YouTube or LinkedIn today. Those are two great platforms that you might want to consider checking out and following us. We hope you enjoyed this episode, and we appreciate your coming aboard, and we'll see you next month for a new live. And in the meantime, stay safe and stay healthy. Thank you, Dr. McManus.
And wash your hands next week.
Always wash your hands. Thank you.
Thank you.